is Markham. This is, I think, a wonderful venue. It's very central to York Region. And we, of course, are so pleased that so many of you from across York Region have come out for this breakfast. For those of you who don't know, I'm Helena Jacek, MPP, for this beautiful riding. And with me are the other members of Team York, the Honourable Michael Chan, Minister of Tourism and Culture, representing Markham Unionville, Dr. Reza Moridi from the Great Riding of Richmond Hill, and Greg Savara, MPP, for Vaughan. Now, thank you all so much for being here. When Minister Dwight Duncan, the Minister of Finance, set out to craft the 2010-2011 budget, he had a really, I think, monumental task ahead of him. His goal was to create new opportunities for jobs and economic growth, while also wanting to maintain the progress that our government has made in healthcare and in education, and also to put in place a deficit reduction plan caused, as we all know, the Great Recession that we have now faced, caused by a global crisis. We in Ontario, perhaps because of so many strong financial institutions that we have weathered the storm fairly well. But we all know that, in fact, there has been a great deal of pain over the last few years felt by Ontarians. When the Premier came to our budget lockup, they lock MPPs up now and again, and this is what happens on budget day. The Premier came at about 3 o'clock, the speech started at 4, and as he addressed our Liberal caucus, the first thing that he said was he was proud of the budget because of what it did to preserve the social programs that Ontarians value so much. We as a government value those social programs, and we believe that having been re-elected in 2007, that we represent, in fact, the values of Ontarians who rely to a very large extent, when times are tough, on the social safety net that we have established in this province. So I'm going to start off by talking a little bit about what this budget does in terms of assisting Ontarians. And I am going to reference the McGuinty government's poverty reduction plan. While you have heard, in fact, that there will be wage freezes, certainly for MPPs for the next few years, and for those in the non-bargaining sector of the public service, we are, in fact, actually increasing assistance by 1% for those on social assistance, those on the within the Ontario Disability Support Program. And they will be receiving a 1% increase in their basic needs allowances and shelter allowances. This will also apply to those living in long-term care. Many of you know that there is a comfort allowance, and that is going to increase by 1%. And I want to emphasize that because it really hasn't been picked up. It is part of what our government is doing to ensure that those with the least financial resource are going to have some assistance looking ahead to support them. You will be hearing from one of my colleagues a little bit more about something that definitely did hit the press, and this was preserving subsidized daycare spaces. As you may recall, the federal government is no longer subsidizing to the tune of some $63.5 million in Ontario, some 8,500 childcare spaces. Our government has decided to, in fact, put that $63.5 million back into childcare so we can preserve those spaces. And in York Region, that is in the order of some 400 subsidized spaces. You may again have heard quite a bit about a special diet allowance. The papers made, the media made quite a bit of this, that this was an unsustainable program for those on social assistance who, where medically needed, were receiving a subsidy to help them with their nutritional requirements that often can be expensive and that they would not be able to afford on the basic allowance. We are replacing that program. It had grown exponentially, so that in fact it will be a new program administered by the Ministry of Health and Long-Term Care, where there will be very strict criteria for that program to ensure that only medically necessary types of diets are accommodated within the program. For those of you, I see Chair Fish, you will be happy to know, because you're here in the York region, that actually at the region of York, we instituted a fairly similar program where when I was the Commissioner of Health Services, we collaborated with our Commissioner of Community and Social Services to ensure that any of those special dietary allowances were in fact vetted by a public health nutritionist. So I'm sure that there was less of this type of ballooning of that program here in York region. Turning just very briefly to healthcare, I think it's worth noting that since our government came to office in 2003, we have increased the healthcare budget by some 57%. We need to tackle this type of ever-growing increase. We cannot have so very much of our resource devoted to healthcare. As a public health physician, I think it has become clear to just about everybody that it in fact is the determinants of health that make our population healthy. So whatever we can do in terms of prevention, in terms of having a good education, getting a good job, having a healthy income, is actually what makes the population healthier than perhaps some of the very high-end medical interventions. So what is our government going to do to try and rein in these dramatic costs? Well, first of all, we're going to be reforming the drug system. We currently pay, as a government, a great deal for generic drugs through that program, more than many other jurisdictions. There have been intense consultations on this particular subject, and what you will see is a proposal from the Minister of Health as to how to subsidize pharmacists and subsidies for pharmacists and pharmacies for the services they provide in a different way than has been done previously, with an agreement to lower generic drug costs. This is a difficult negotiation. It involves many, many stakeholders. A lot of work's been done, and you'll hear more on that in the future. A particular area of the budget that was of great interest to me, and it was in fact suggested by many of the people in this room, was that within hospitals, many diagnostic procedures are being performed, sometimes duplicating those that had already been done, perhaps in the community, but where perhaps there were not very strict clinical guidelines as to when some of these very expensive procedures might be undertaken. So there will be an expert advisory committee assisting the Ministry of Health, looking at standardizing clinical practice guidelines in these areas. This is obviously a way at looking at savings within the system. There will be also a review of the Public Hospitals Act with a view to ensuring that community partners are part of the process and health professional expertise is used to the ultimate to ensure that our healthcare system remains as efficient as possible. Anyway, I have just given you a brief overview of these particular areas, and I'm now very pleased to hand over to my good friend and colleague, the Honourable Michael Chen.